This is a Dubai Eye 103.8 podcast.
Afternoons on Dubai Eye 103.8.
It's Zina Zalamea in for Helen Farmer. And are more children becoming short-sighted at a younger age? Doctors here in the Emirates say screens are only part of the problem. So we'll look at the other everyday habits that could be affecting your child's eyesight and the simple changes parents can make. And are you guilty of the new rude? RUDE, voice notes instead of texts, earphones at the checkout, phones at the dinner table, and I'm talking about digital etiquette and whether smartphones have completely changed the rules of good manners. We're meeting the woman who started playing badminton with just a couple of friends and has since built a community of around 3,000 people, all based around a simple idea: making friends while you move. And later on, we're talking women's football. Banat FC are celebrating a landmark season after becoming UAE Women's Champions and winning the inaugural UAE Women's Super Cup. We'll look at the club's success and the growing opportunities for women and girls in the game here in the Emirates. And then we're giving you your finances a mid-year checkup. We're talking about money. If the money goals you set at the start of the year have gone a little off track, that's understandable. Don't panic. We'll look at how to reset, rebuild your savings, and make the most of the rest of 2026. And we're also talking debt, whether you're struggling to keep up with repayments, feeling overwhelmed by what you owe, or simply want to clear your debts more quickly. We'll look at the practical steps you can take. I'm not an expert, but I will be joined by one in a few moments, Carol Glynn of Conscious Finance Consulting. She advises women and men on how to save, budget, and invest. We're talking about your child's vision, your child's eyesight, because if you're worried about your child seeing clearly, chances are you've probably blamed the tablet or the phone at some point. Now, we're lucky because the doctor is in. Joining me in a few moments is Dr. Mohit Jain, a specialist in ophthalmology at the NMC Royal Hospital in Sharjah. Good afternoon, Dr. Mohit Jain, joining me all the way from Sharjah. How are you, Dr. Jain?
Very good afternoon. I'm good. It's my pleasure to be here.
Thank you for taking time out from your clinic to advise us, because really a lot of parents are worried. Now, let's set up the problem here. A lot of parents are worried that about their child's eyesight, and they're blaming that on screens, basically. And I myself can't count the amount of times I say, put that screen down, you'll ruin your eyes. That's what I do every single day. But it turns out, Dr. Jain, screens is only part of the story. And doctors like yourself are saying they're seeing more children develop myopia or short-sightedness at a younger age. That's very worrying. So before anything else, I'd like to ask, what exactly is myopia or short-sightedness, and why are children developing it at a much younger age?
So excellent question. And this question I used to get every day in my practice. And what I observed that over a period of time, we are seeing more younger kids are getting myopia. So what is myopia exactly? See, myopia is a condition where your kid or a person is able to see clear for the reading objects like book, tablets, but far vision is blurry, like watching the school board, sign, traffic signs, TV, something distance. So here, child is good to see clear for the reading, so he engaged more in the reading activities. And this trend is more observed in younger kids. That is alarming. That is concerning.
How young are we talking here? So what was the usual age that children would develop myopia, maybe from watching TV or reading a book when their eyes are too close to a book, for example, and versus now when they're using screens so much?
Yeah, so actually, there is no particular age for myopia to develop, but on an average, we observe that the trend for myopia starts around 5 years of age. I'm just giving a broad idea. It generally starts around 5 years of age, and most of the kids generally come to clinic in the age around 8 to 10 years. Actually, this, all the parents and all the social media are all concerned of screen time. Screen time is just one part. So actually, when we ask the parents reduce the screen time, we force the kid to reduce the screen time. It doesn't work because they are not able to understand what is the reason behind it, why it is affecting our eye. So I just try to clarify for the better understanding. So anything which is closer to our eye, whether it is a book, whether it is a tablet, drawing, crafting, painting, Lego games, anything where we need to focus for long for the near object causes strain on the eye that affects eye in a way that number comes up or number increases. Tablet, computer screen actually culprit because kids are more glued to them. They are more interested in them and they do uninterrupted long hours work. So there are 2 points we have to understand. Anything which is near work, anything which is uninterrupted and prolonged affects the eye. It is not just the screen. We have ways to reduce it, but blaming only the screen is not the solution. We have to look compositely that child spend lesser and lesser time for the near activity, that too uninterrupted for the long duration.
And what are some examples of near work?
Yeah, so actually, I say parents that don't give the tablet or phone to the kid. It is not good for the eye. And next time, child come with a drawing paper and coloring in my room. So I say that anything which is closer to the eye, like coloring, drawing, painting, crafting, Lego games, is not good. Same thing, excessive gluing to the screen, laptop, mobile, computer, it is not good. So what they should do, like when they are in the spare time, they should spend time for the outdoor activities. The older days we used to play at home, like the play cards, carom board, different games. But these are absolute now. So we have to change this type of pattern. We have to, the more importantly, even all the studies now in the school are on screen. So the parents have a concern that there's no books now, everything on the screen. We have very interesting, very beautiful way we say as a golden rule 20-20-20. It
Okay,
says
tell us
that,
about that.
yeah, very interesting. It is not just for the kids, it's for the everyone. So whenever we are working on the computer or any screen or any near activity, after 20 minutes of the work, take break, take off your eyes from the screen or the near object and look something which is far more than 20 feet and try to focus something that far object for at least 20 seconds. So what you are doing essentially, you are breaking your focus for the near and relaxing the muscles so that they can see the far. So
Okay, and
this
you're giving
break
your
in
eyes
the
a break. You're giving your eyes a break.
break,
Now,
yeah, yeah.
speaking of break, we're heading to Andrew next for the traffic news. But before that, I'd like to know, Dr. Jain, are there certain children who are more at risk of developing myopia? Sometimes I see entire families wearing thick glasses, and I wonder if certain eye conditions could be genetic.
Yes. So unfortunately, it is having a very strong genetic predisposition. Either one parent or both parents are having glasses, or your sibling is having glasses. You are at risk to get glasses at early age, and there's a risk to rapid increase in the number. So genetic is one of the strongest association, and some lifestyle, modification like excessive near work is, and one more important,
And,
lack of outdoor work,
oh, yeah.
outdoor daylight. So 2 hours per day, we should have a work or activity in the daylight in outdoor setup.
Okay, that's what I'm
So
going to
this is
ask you
missing.
about next, Dr. Jain, because it's impossible to go outdoors for 2 hours, especially for the children in this weather. So that's a question I will put to you. Have a think about it. Okay, Andrew, I noticed that you're the only member of the newsroom who isn't wearing glasses.
Really? That's well noticed actually, but I have had laser surgery.
Oh, when?
So I had the surgery 2006. So I was given that it would have a 10-year lifespan. So that was 20 years ago now. I now start wearing glasses for nighttime driving, but that is all.
That's amazing.
And I was hearing Dr. Mohit say a lot of it is genetics, but there's no other eyesight problems in my family, apart from myself and my brother. We're the first ones.
Oh, wow. But in terms of lifestyle, what are some of the habits you've developed so that you maintain that clear vision?
I think actually not staring at screens. That was something I really realized quite quickly because I also suffer from dry eyes. So that was also something that I was told to avoid. Staring at screens helps dry out the eye, which exacerbates eye strain, obviously, and that could, they believe, add to deterioration in eyesight. So it was more about ensuring I'm not staring at a screen, and always my grandmother's adage: don't sit too close to the TV.
Yes.
Always told that. And I carried on. I believed that growing up, that sitting too close to the TV would leave you with square eyes, as my grandmother said.
Square eyes.
Yes.
Well, that applies to all the screens now. Do you carry eye drops with you?
Yes, I do. And I use them every single day.
That's really good advice.
In the morning, in the afternoon, because also I was told that if you overuse them, they become less effective. And also I have two little plugs in my eyes.
What are those?
So they're little plugs that go into the tear duct
Okay.
to stop your eye draining tears down into your tear duct.
Oh, wow.
And that sort of helps with the dry eye condition.
First time I've heard of that. We're taking really good advice from Andrew on how to maintain your vision, your clear vision. Not only do you have clear vision, you've also got clear eyes.
Yes, and that's also due to the eye drops.
That's amazing. But actually, a lot of people can relate to this. We've got a text from Isabella saying, I became short-sighted at 11. That's when I had my first pair of glasses. My teacher noticed that I kept squinting and moving closer to the blackboard. And I also used to play games on my Nintendo Game Boy. Remember that Nintendo Game Boy? I go way back to the Nintendo family computer. That gives away my age. And Isabella added, I also have dry eyes. They get very dry with my contacts. Okay, Dr. Jain, do you have a patient with you right now?
No, I'm good. I'm waiting for your reply.
All right. Thank you. So a few minutes ago, we talked about why children may be developing myopia at a younger age. Your advice is really don't look at a screen, a book, a piece of paper for prolonged periods of time. Make sure your eyes are taking a break. And one of the pieces of advice that you gave was spend time outdoors, at least 2 hours. That is amazing advice, but how realistic is that during the UAE summer? Do you have any alternative tips on how to give your eyes a break?
Yes, so this tip I give all the time in my clinic. It is not 2 hours straight. First, why outdoor and why daylight? Actually, daylight, the sunlight is good for the development of retina. Sunlight makes dopamine inside the eye, and that regulates the eyeball growth, or I can say the onset of number or progression of number. So it is not like 2 hours straight. Make a habit like before the kids go to the school, he take a 15, 20 minutes walk. Once coming out from the school in the shaded parking lot, he can just do a 10 minutes walk. Evening time, just is a family time, everybody go for a walk for 15, 20 minutes. On the weekends, you can go for a park and just try to get, something which is shaded. Swimming, it is outdoor activity, daylight. So we need to break the 2 hours in 20, 30 minutes segments and split between the entire day. And one important habit, like after working on computer, mobile studies for 1 hour, make a visit to balcony. So that is my special tip to the parents. I always say, make a count for the balcony. Balcony is the part of our house. You open the door, you can, go in balcony. There is, all light. It is not so hot. It is shaded, and try to use maximum use of your balcony. Go frequent trips. Open the AC or the, some fan or something, so you can spend some time. So I believe 2 hours is very practical in this hot summer season. It is need more motivation. You have to be a bit more organized, but it is doable.
It is doable.
And more important,
And when you break it
yeah.
up into 5-10 minute walks outside, and that advice about going out to the balcony, it suddenly becomes more realistic. But Andrew and I were chatting about how he has clear vision and he had laser surgery decades ago, but he maintains his clear vision by taking a break and also using eye drops. Can children use eye drops on a regular basis?
Certainly. Now, the eye drops we are talking about is the lubricating eye drop. These are preservative eye drops. So, preservative means free means there is no component in the eye drop that can adversely affect the eye surface. Other than that, they don't have any active compound. So, it is having no long term effect on the eye surface. It is like a moisturizing cream for your skin. So, this environment, UAE, is quite hot, and most of the time we stay indoor with the AC environment where there is a airflow, constant airflow that makes our eye surface dry. So whenever we find certain symptoms in the child and or some sign, we prescribe lubricating eye drop like excessive itching, sometimes redness, watering, squinting. We prescribe eye drops and they are pretty safe to use.
Okay, so eye drops pretty safe to use for kids, but now how often should children have an eye examination? Is it every 6 months like the dentist? And even if they're not complaining about their vision, I believe these regular checkups are crucial.
Certainly, certainly. So the standard protocol is once the kids start going to school around 3 to 5 year of age, thereafter once in a year, if there is a family history of glasses like parents or sibling, better to check even more frequent regular intervals. Like if the ophthalmologist advice for every 6 months, that is also fine. So once in a year is recommended around 3 to 5 year of age, first examination. And thereafter, even though you don't have eye symptoms, do a regular eye examination.
Okay, and Dr. Jain, may I ask, what's the treatment for myopia? Can it be cured completely, or can you just kind of slow down its progression?
See, this is the most important aspect. This is the most important aspect of our discussion. 20 years back, I had a glasses since childhood when I got the glasses when I was 5. So that time we go to the ophthalmologist, their role is just to give the glasses. And believe me, my glasses keep changing every 6 months to 1 year. Every time it increased. And there were just one option to increase the number. But now we are in an era, now when we are in an age where we have most rewarding development in the eye care, that is myopia control glasses and eye drops. So there are some evidence-based medicine where we can control the myopia. We cannot eliminate the myopia, but we can delay the onset, or if it started, we can delay the progression of the myopia. So we have 2 or 3 certain strong evidence-based techniques. One is myopia control glasses. Another is low dose atropine eye drop. So these two things having the most rewarding results to control it.
And I'm sorry, we're running out of time, Dr. Jain. Apologies for that. I have to cut you off. But he is Dr. Mohit Jain, specialist in ophthalmology at NMC Royal Hospital, Sharjah, if you want to pay him a visit. Thank you so much for joining us. Those are really good tips for parents and children alike to maintain their clear vision. And if you've got early signs of myopia, please visit an ophthalmologist like Dr. Jain. Thank you so much for your time, and we'll let you go back to your clinic.
Thank you.